So welcome everyone. My name is Fay Yarbrough. I'm an associate professor of history, and I'm also associate dean in the School of Humanities. And I'm happy to welcome everyone to a Humanities Now conversation today with Professor Kirsten Ostherr. And just so you know, if you haven't been to one of our conversations before, one of these Humanities Now conversations, they're really a way for us to connect what we do in our disciplines in the humanities to present day situations and issues, and also a way to introduce some faculty to more people, so then you can hear about the excellent work folks are doing and maybe also be interested in taking classes with some of the people that we have conversations with in this series. So there are two more Humanities Now conversations left this semester. The first is with Caleb McDaniel on March the 11th, and it's going to be about voting. It is also connected to our Women's History Month speaker, Martha Jones, who's going to talk about Black women being the vanguard of voting. And I think, as I keep saying to folks, she could not be a more on point speaker in this moment where we're all, thinking about people like Stacey Abrams and LaTosha Brown, who did all this work in Georgia. We have our April speaker will be Travis Alexander, who's going to talk to us about plagues and protests. And I'll put links to all of this in the chats when Professor Ostherr gets started. I also want to note that next week on the 19th, the Center for African and African American Studies is having an event that looks at the history of those kinds of programs, Centers for African and African American Studies in the region, and the connections that are being made between the program at Rice and other ones at places like Texas Southern and Prairie View. And lastly, that we're going to have Eddie Glad as our Campbell Lecture speaker. And that's on March the 4th. So again, I'll put all of that in the chat. Okay, so today we're really fortunate that we have Professor Kirsten Ostherr with us today. She's the chair of the English department and also directs Medical Humanities. She's going to share a little bit of her research with us today. We're asking that if you have questions, you can ask them in the chat, or after her presentation, you can use the raise hand function and you can ask it directly, right? So she'll give a presentation and then we'll open things up for questions. So Professor Ostherr, please take it away.
All right, thank you so much, Faye. Thank you for the introduction and for the invitation to be here. Thank you all for joining us. I'm going to share my screen and talk to you. Let's see. Do you see my slide? Yes. All right. So sorry, did someone say something? Okay. So I want to talk to you about this project called Translational Humanities for Public Health that I started last spring and have been working on with an evolving group of collaborators. And I want to just talk through kind of how this project came to be, how it was motivated, and what approaches, translational approaches, are starting to emerge from it, and what it has been telling me about how I think about the kinds of methods that I use in my own research. So the project really started at the beginning of the pandemic, when I was noticing how societally, how we were responding to the emerging pandemic. And I pose this question here: how have technology and data-driven frameworks shaped the visualization of the pandemic? Because my training is in film and media studies, and I do that in the context of medical humanities. So I'm always looking at questions of visual representation and how visual representation shapes our understanding of things that happen in the world. That visual representation is, of course, always mediated by technology. And in particular, right now, many of those technologies are about producing data that is driving the way that we think about the pandemic. So I was asking this as I was observing how the initial responses to the pandemic were taking place. And the question I was asking was kind of at that moment, what do we see? What does the pandemic look like? And what remains invisible? And two things that I just want to emphasize in the early days, you probably remember the focus on ventilators, right? Very early on, we heard this in China, then we heard this in Italy, and then we heard this in the United States, that there weren't enough ventilators, that people, had a lot of difficulty with breathing with COVID, and we needed more ventilators. And so some companies that produce other things like cars started producing ventilators. And some students, like students in our own OEDK, the Engineering Design Kitchen, and faculty there started going to work to develop low-cost kind of do-it-yourself ventilator technology. And this was clearly meeting a real need, or at least a perceived need. And what I want to emphasize here is that this is one of the framings of the pandemic early on, which was that it needs a particular kind of technological solution. Okay, so that's the ventilator is in a way a technological solution to the pandemic. But one of the things that we learned pretty quickly actually was that ventilators not only won't save us, but may actually be doing more harm than good in many situations. We have since learned that actually masks, which are an incredibly low tech or no tech sort of solution, get us a lot farther than any advanced technology does. So it was very understandable that a lot of people who wanted to help thought of ventilators as a way to do it. But this also speaks to a larger kind of technological framing of illness that then leads to certain consequences. The other framing that I want to just draw attention to at the beginning here is the emphasis on data and the way that that has led to certain kinds of visualizations, but especially certain understandings of what is actually happening with the pandemic. And the thing that I want to draw your attention to, I guess going back, I should have had one image, which is the Johns Hopkins data dashboard, which I think everyone is familiar with. And there are many other data dashboards that we all have been looking at constantly to see and understand the pandemic, right? But that shows us a picture of the pandemic that, of course, is drawn from the data that exists. But here I'm pointing out that, if, for example, if testing sites are largely oriented towards white communities and not towards Black and Brown communities, for instance, then the data are going to represent incidents in those communities and not in the others. So missing data then leads to really incomplete narratives that you can draw from those visualizations. And I want to point this out because it's kind of shocking now still to realize that as of April of last year, we basically weren't getting much reporting on racial and ethnic data. So Ibram X. Kendi talked about in The Atlantic about how it seems like there's a real racial bias in how the pandemic is actually affecting communities, but that it seemed that way and we couldn't be sure because we didn't have the data. I read recently, actually, that as the CDC has started releasing its case reports drawn from across the entire country, that many of them still to this day lack racial and ethnic data. So there's a huge gap in the data. So these were a few points that may be familiar if you study science and technology, but I want to just emphasize them because they're important points to kind of draw from, and that I drew from early in the pandemic. One, that technology is always socio-technical. Two, that data are always missing and messy. And three, that COVID-19 made it very clear that medical or health humanities needed to engage with both technology and data. So this led me to ask, what is lost from the pandemic response when humanities or translational humanities contributions are missing? So, early on, so I was noticing these emphases on technological solutions and on data-driven understandings of the pandemic early on, and thinking about how those responses might be different if we were looking at the pandemic through more of a humanities-based lens. And this led me to which you write a couple of pieces that I'm going to mention to you briefly in a minute, but also to submit a proposal to the Rice COVID-19 Research Fund, which was funded, which is how we got the start for the Translational Humanities for Public Health project. So that got funded in, I think, maybe April or May of last year, and we've been working on it ever since. So, so when I ask, let me just go back. When I ask what is lost from the pandemic response when humanities contributions are missing, I'll give just a couple of examples. I've already talked about the what's missing when we look through a technological and data-driven frame. Ali Al-Khatib commented in this piece that we should care that the gaps in our knowledge will be consequential and not random. Those gaps being, for example, what we miss when we miss data from people who are not counted, right? That these gaps will sabotage our efforts to understand what's actually going on in the world and undermining our response. So what he's talking about is not just the fact that we have an incomplete picture, but that incomplete picture really undermines our efforts to actually get out of the pandemic. A really concrete example of the missing racial and ethnic data is that for months at the beginning of the pandemic, Native Americans were not being counted as a category. And so, as is represented in this quote here, basically, you know, what Abigail Echo Hawk is saying here is, you know, if you eliminate us in the data, we don't exist. You can't get resources if you're not counted. Similarly, when you think about contact tracing, the lack of trust in health authorities, as Caitlin Esmond talked about in this piece, and she also contributed to a study of digital contact tracing at Johns Hopkins that was a really useful study of digital contact tracing and the ethical issues. As she emphasizes here, you know, the issue of trust is a really profound one that very much shapes the question of who appears in the data and who does not, and how that then produces the kind of lopsided and counterproductive responses that Ali Al-Khatib was talking about. And of course, this is going to then influence vaccination patterns as well, right? So we have to understand the technological frame and the data-driven frame in relation to what is left out of that. And one of the big things that's left out of that are the social relations that include things like histories of racism, which lead to real questions about trust. So Ramesh Raskar at the MIT Media Lab commented, his team was trying to develop a digital contact tracing tool, and he commented, how do you create a solution that doesn't end up being a tool of the surveillance state? That's the biggest challenge for us. So, you know, you think about these questions of trust and these questions of who's counted and who isn't, and all of that really influenced, to me, it made me think a lot in the early days of the pandemic about the fact that there are so many people in humanities and humanities related fields that are doing work that would lead one as a policymaker or as someone who is intervening in the pandemic to foreground issues like histories of racism and the way that that impacts trust in technology, trust in data collection, trust in medical institutions. And by prioritizing that, we would have actually foregrounded responses that question and critique the role of racism, for example, in how we were responding to the pandemic. That would have been part of the leading response. So this really led me to think about how, you know, data tracking and technology development are really in need of humanist intervention, which is something I've been, you know, aware of and have written about in my work for some time. And I really saw that there was a need for humanities methods that were already addressing these kinds of issues to be translated into the policy realm and the public health realm in such a way that we could kind of close that gap so that social justice and health equity could become part of the solution by design, rather than becoming apparent as something that's missing from the solution after the fact. So I wanted to kind of try to, you know, imagine a way that we could flip that sort of cause-effect relationship by foregrounding humanities methods in the intervention. So I mentioned I wrote a couple of pieces that also shaped my thinking about this project. I've written a couple of books that are about the histories of film and other visual media my first book was about representations of contagion in global health. And my second book was about visual representations in medical education. And so drawing from that, I wrote a piece that was published in the Washington Post back in March of last year, where I was just looking at the kinds of media and the kinds of rhetoric that were coming out around in the early months of the pandemic. And it really, really resonated with public health films that I had studied that were from 100 years ago, that included a lot of racist and xenophobic narratives. So especially anti-Asian racism, which we saw early in the pandemic in a really big way and which hasn't ended. But that was one of the things that I saw, that I've seen in older public health films too. And I saw a really strong through line there. And so I wrote about the ways that visual media kind of perpetuate these racist contagion narratives. And then I also wrote this piece in May that was building on a number of projects that I'm going to mention right now that really shaped my sense of the need for collecting and representing for public use and for policymaker use, the projects that I saw as responding to the pandemic in a way that was utilizing humanities methods, but to produce different kinds of things than what we usually produce in the humanities fields, which are more scholarly products. So this was a piece where I gathered together a whole bunch of those examples to start thinking through this idea of translational methods. So one of the examples that really shaped my thinking early on was this project called the Stop AAPI Hate Reporting Center, which was started by Russell Jung, who's a professor of Asian American Studies at San Francisco State University. And he was noticing many examples of xenophobic attacks on Asian American and Asian people in the United States that he saw, and many others did too, as directly linked to the racist language that was coming out of the White House, like all of the like Wuhan virus and all of that stuff that was happening a lot early on, as you probably remember. So he started this site where he was just documenting all of the incidents so they could be in one place so that he could use that to show policymakers like, look, this is happening. We need to address this proactively. Another thing that I was intrigued by along these lines was the UN did this call for creatives where they asked for artists from around the world to create like public health messages, visual messages on a bunch of different topics. They were like on personal hygiene, on physical distancing, on knowing the symptoms of COVID and those sorts of things, myth busting. And they asked people from all around the world to submit their designs so that they could produce them in ways that would emerge from and resonate with different cultures around the world. And so I was really struck here by the ways that that art and culture were really kind of central to their recognition of what makes health messaging actually work. Here are a couple more examples. I found this one with the neon sneeze particularly funny, but very visually arresting too. And so there's one from Brazil there, one from Belgium, one from Panama. But if you go to the site, you'll find them from all over the world. Another example here, you know, when you think about the kinds of methods that were being used early on, again, the technological frame, the data-driven frame, there was a piece in Scientific American that was about the value of history for just learning what are the actual interventions that are effective. And they write in this piece about how historians had already observed that social distancing, communication, and international cooperation were the most effective methods to halt previous pandemics, and that they were suggesting would probably be effective for COVID. And indeed, these are all low cost and not technological, and comparatively easy to implement apart from the politics of it, right? So, but this is a way in which looking at the kind of looking at the pandemic through the humanities lens really shows that there are actually methods out there that we could implement if we thought about them as methods in this way. Along similar lines, there's been a program that is sponsored by the World Health Organization called Global Health Histories that's been going since 2004 and is run by Sanjoy Bhattacharya at the University of York. And what they do is they basically have historians and other humanities scholars present their work in a way that's deliberately translating it to highlight the lessons for current public health practitioners. So for people, field workers at the WHO and policymakers at the WHO. I did one of these a few years ago, and it was just a really interesting way to think about presenting my own work to that audience. Okay, so, and then, in terms of thinking about the humanities response directly to this issue of the technological lens and also the data lens, there are many approaches that can reframe data as an expression of societal values, and that can then kind of flip how we think about the data as producing meaning, to understand not just the gaps that I was talking about earlier, but also to highlight how the sources of data or the places where data are coming from are in a way a representation of societal values, and what the philosopher Kwame Anthony Appiah called in a piece that was long before COVID, our society's moral failures. And he, in that case, was talking about prisons, factory farms, and nursing homes. But that piece was revived by someone writing in Vox last year, because of course those were exactly the places where there were some really big outbreaks. So he was drawing that sort of philosophical frame together with the COVID context. Similarly, on the kind of contextual data science front, projects that are about that are focusing specifically on COVID behind bars, like this one at UCLA Law, and this other one that's drawing together vulnerability to climate change with vulnerability to COVID-19 at the Urban Systems Lab at the New School in New York City. These are, additional examples of contextual data science that, to me, are ways of bringing humanities and qualitative social science methods to the pandemic situation and reframing, if we're going to look at this through a data lens, what are the ways that we need to kind of interpret and critique those data to get a fuller and more equitable picture of what's going on. D'Ignacio and Klein wrote this book, Data Feminism, that came out recently, and they kind of adapted part of it for a piece that they published in Big Data and Society last year that was specifically responding to COVID. And one of the points that they made there that I found particularly compelling was about the role of emotion. So in other research that I've been doing over this past year, looking at things like contact tracing and the question of trust, which I mentioned earlier, there's a big question about how the role of emotion itself can actually lead people to either participate or not participate in prevention efforts that may have a really big impact on the state of the epidemic. The emotions I'm talking about in this case are emotions like fear. So the Harris County Public Health Department right here in Houston has a myth-busting poster that they produced for COVID that is all about answering questions about contact tracing that are addressing people's fears, specifically like, could I get deported if I'm contact traced? Do I have to pay for contact tracing? Could I lose my job? Could I be put in jail? All of these things that that very much shape, again, what kinds of data exist about the state of the pandemic and which do not. So I liked their point here that to undertake responsible data visualization in a health crisis, that we need to do this, undertake responsible data visualization in a health crisis that is having disproportionate impacts on specific populations. Two other projects that to me very much resonate with this question of how to use humanities perspectives to contextualize data frames for the pandemic are COVID Black, which is a project at Purdue, a collaborative project that is developing a big database of obituaries for African Americans who have died of COVID and trying to understand the impact of the pandemic differently through that. And then Data for Black Lives, which is gathering all kinds of data, again, specifically going back to the gap that I mentioned early in the talk, in order to attempt to do what they say here, which is, they argue that all of the new data systems that we have that can be used as tools of the surveillance state, as I mentioned in that earlier slide, have the potential to empower communities of color, but as they write, history tells a different story, one in which data is too often wielded as an instrument of oppression, reinforcing inequality and perpetuating injustice. So, so this question of how we can intervene in these data frames to make them be used for other purposes is again part of what I'm seeking to do with the team in the Translational Humanities project. And I'll describe that a little bit more in just a minute. I'm getting to the end of this part. Another thing, though, that I drew inspiration from was this piece from back in April that described how the country of Germany was enlisting philosophers and historians of science and theologians and jurists as part of their teams that were coming up with COVID policies and reopening policies and those kinds of things. And what I was imagining at this time is how would the policies look different if people who have expertise in all the fields I've been talking about, like data feminism and critical race studies, and science and technology studies, history, right? The history of visual representation, philosophy, what would the response look like if those perspectives were part of our policy team? And to me, this is of course very connected to medical humanities and health humanities because there have been efforts to bring data together with narratives to produce more contextual and better rounded understandings of patient experiences. That's been something that's been part of the field of medical and health humanities prior to the pandemic. So it's not like this, it's not like these efforts don't already exist, but they need clearly to be brought much more directly to bear on the ways that policy decisions are being made in this context. And so this project, which we got funding from Rice initially, and then we've gotten some other sources of support, what we wanted to do was, first of all, just gather all of these different kinds of projects that I've been talking to you about, like the Stop AAPI Hate, and COVID Black, all these other kinds of projects where people are using some kind of humanities or humanities-inspired method to address the pandemic in a way that gives us a perspective and ideas about intervention that fills in those gaps that I was talking about at the beginning. So we developed a survey that asks people about the kinds of work that they're doing and also what different fields they're drawing on, if they are drawing on humanities fields in that work. So we developed this survey I did with the team. Here is most of the team, though we're missing one student whose name is Megana Nadella, and she is a visual and dramatic arts and health sciences double major with a minor in medical humanities. But actually, I want to highlight all of the other fields that people are in who are working on this project. We have an undergrad who's majoring in classical studies and neuroscience. We have a recent history PhD and a current PhD student in history, a current PhD student in English, a postdoctoral fellow in medical humanities, another current English grad student, an undergrad who's majoring in health sciences, as well as Spanish and Portuguese, and then some support from John Mulligan in the Center for Research Computing. And we've had several other faculty colleagues who have guided our work and given us really useful feedback, including my colleague Lan Lee in the history department and in medical humanities. So this whole team, some people have been involved in earlier parts, some in later parts, and we worked on developing this survey in the beginning of last summer, which we also then were developing a big database of the people we would send it to. And those people were the people doing these kinds of projects like I've been telling you about, that to me exemplify this kind of translational humanities work. And so we've sent the survey out to hundreds of people all around the world, and we've gotten back about 260 responses. We're now systematically building out different regional databases to make sure that we can capture examples of the kinds of work people are doing in all of the different parts of the world, and also learn from the ways that responses look different in different places, and also as the pandemic itself is experienced in a different way in different places. So we're now working on developing the public-facing website for this. So what we're doing with all of the survey results is we're creating this website that will be searchable, the intent of which is really to gather all of these kinds of translational humanities approaches and then represent them for different kinds of users in ways that would be useful in facilitating this kind of closing of the gap that I've been talking about. So we want people, for example, we want policymakers to understand that if they brought in people who do critical race studies early on, for example, it wouldn't have come as a big surprise that there would be serious health disparities along racial lines in the pandemic, which, if you recall, about 5-6 months into the pandemic, the research was finally showing this. But people who do work in these fields knew this from the very beginning, right? So we didn't have to wait for that discovery, so-called discovery, to be made. We want to kind of represent this work in a way that will be readily accessible and that we can promote to policymakers as one example of a user group. But another user group is people in higher ed who are looking to train their students to do this kind of work, whether at the undergrad or the grad level. So you will also be able to search by the different humanities fields that are influencing the different projects that people have submitted survey responses on. So you'll be able to kind of look at this and see, in different disciplines, what kinds of approaches have people used. And my hope is that this will also enable people to develop intentionally classes, maybe contribute to programs that are intentionally developing or doing humanities work in a way that is deliberately translational, meaning deliberately closing the gap between the stuff that we do in classrooms and problems that exist in the world, such as the many that have been produced by the pandemic. So this is actually our QR code. If anyone in the audience is working on a project that they think is relevant, we would love for you to fill out the survey and be part of the database. So you could scan this, or you could just Google the Medical Futures Lab on the RICE website and you'll get there, and we have a link there as well. And so I'll leave this up for just another second in case anyone wants to scan that. So for me, this connects to work that I've been doing for a while, in that I have wanted my scholarship on visual representations of medicine and public health to actually inform people who are working in those fields, both so that they can understand what some of the kind of embedded values are in the technologies that they are using that they may not see through the same perspective that I do, but also so that the work can kind of potentially lead to openings for thinking about how to address some of the problems in the history of medicine and public health that have to do with representations that, again, like I mentioned in the piece in the Washington Post, that we see that there's a really, really long history of racism in public health media that may often seem subtle for the people who are working in the field. They may not notice it, but when it's pointed out, this then, of course, develops an opportunity to intervene and to change what what those kinds of representations might look like. So I'm gonna stop my share now, and that's really kind of a big overview of how the project came to be and what we're hoping to achieve with it. And I would be really happy to take any questions or comments. Thank you.
Thank you so much. Okay, so we are now open to questions from the audience. Again, you can use the chat feature, or you can use the raise hand feature and ask a question if you would like. It's been my observation that sometimes it takes you all to decide on the question you want to ask. So then I take it as my prerogative to ask a question in the meantime. I actually have two questions. Well, one maybe more of an observation. But so the question is, in doing and thinking about this translational work, do you see that there are that there's still resistance on the more scientific side of things to thinking about the questions and issues that a humanities approach is bringing? Or has the pandemic really made obvious and clear to people that they should be thinking about it, right? I mean, on the humanities side, I think folks, scholars who are familiar with and are part of the humanities see the value in right away, understand. I'm curious about what the response has been on the other side. And then just as I say, I don't know that this is actually a question, but the observation that you pointed out in so many different cases where we can see that the effects on communities of color have been stronger, and that if we had talked to people who were more familiar with humanities, they would have been able to point out that this was likely to be the case, right? And I couldn't help but think back to the very early days of the pandemic, when there were lots of actual myths and rumors that, no, actually people of color are less susceptible. I remember there was some of that floating around. Oh no, people of color are less susceptible. And so that the information getting out sooner, earlier, or these approaches being employed earlier could have also combated that, right? So not just predicted the problem, but maybe stopped some of this idea that was there in the first place. So there's that part, and then just what the response has been on the more scientific, technologically oriented population, if they've been open and receptive to these approaches.
Yeah. So thank you. I think let me preface this by saying I fully recognize that this could seem optimistic to the point of idealism, right? That these perspectives could be brought into policy responses. However, and of course, under the previous administration, like that was not really something I thought I saw happening. But I want to point out, I know some people on the webinar may already be aware of this, but a couple of weeks ago, the Biden administration appointed the brilliant science and technology and African American studies scholar Alondra Nelson as part of the science and technology policy team to lead. She's, I think, the deputy director of science and society is what it's called. She's trained as a sociologist. She does incredibly important work that is very much along the lines of the kinds of things I've been talking about here. And she's now in this really important role. So to me, that gives me a lot of hope that the optimism I would say that fuels my this approach is grounded in something that has some real possibility. But the other thing that gives me that optimism and that makes me think that it is possible really is the response by scientists and engineers and medical doctors who I think it's very true what you've said, that the pandemic has made it abundantly clear how limited the technological frames are for biomedicine, for example, and how some of the greatest suffering that has occurred has been a kind of suffering that a technological intervention cannot solve, right? And so I have been involved in collaborations of various kinds with people in different science and engineering and medical fields in the context of the pandemic, who all are quite explicit in their appreciation for what our methods and approaches bring that they don't have. I'm sure, of course, there's still folks out there who don't share that perspective, and there always will be. So, you know, that's fine. But I do see that there is a kind of shift that has been occurring for a number of years, and that has perhaps been accelerated by the pandemic, which is just a recognition that the human experiences of suffering and of healing draw much of their energy often from things that are not typically considered to be part of the biomedical response, like art. I mean, so many people have drawn from different kinds of art to get through this and to actually even recover. And this goes for clinicians too, who of course are suffering greatly, as are patients and as are communities, and especially communities of color. So the ways that people express what they're going through and kind of document it is all the kind of stuff that that's like our material. That's what we work with, right, in the humanities. And so the recognition that those are not sort of like the optional nice things that you can do when you have time or something, but actually are the things that make it possible when you're in the most severe crisis to go on, is something that I've really seen in a lot of the responses in the Translational Humanities project. So I find that really encouraging and interesting. And it's one of the things I'm really looking forward to delving into in the database, is to really kind of identify and surface sort of the patterns in terms of, you know, the context that people are in and the methods that they draw on to address particular problems, and sort of what that tells us about the kind of translational work that's already going on, and what we could, how we could build on that to bring this kind of work that can be very powerful into settings that are not as acute in some ways as like the emergent experience of the pandemic, but that are ongoing crises like the climate crisis. To me, all of the work that is being done in this context can, and sometimes it already does, but it certainly can speak to that too, which is of course also an ongoing societal-wide crisis that needs responses that are not just technological.
To our audience, does anyone have a question that they would like to ask? I feel like you're all being super shy because you also, nobody likes to have their screen on. All right, Long Lee, please go ahead.
Oh, hi. Thanks so much, Kirsten. I just actually sent you an email of another humanities paper that has been on counter visualizations during COVID. And I had a question about for translational humanities. I've been thinking a lot about, since you started this project, on this idea of first responders, like all they had to do, this relates to Fay's first question, if they just had like asked someone who had studied critical race theory, they like all this, it wouldn't have intensified a lot of the existing racial violence. But I was wondering how you see translational humanities intellectually and kind of genealogically fitting with academic activism. Is that you mentioned that this also engages with, it's intended to engage with a number of audiences and people who are working in policy. But is there a clear intellectual kind of thread or relationship on that side? Thanks.
Yeah, thank you. I mean, there are many, and they kind of play out differently in different realms. So one of the things that we did want to do with the survey is make sure that it wasn't tailored exclusively to academics. We really wanted to get people in community-based organizations to contribute. And also, as we know from many of the projects that we have with our students and colleagues, there are many community-based organizations that academics collaborate with in some way, right? And the folks who run those centers also draw from work that scholars do, like the history of feminism and the history of critical race theory. All of those, like, you know, there's the academic and the activists are very much interwoven. And sometimes it's really evident in a particular kind of outward facing work. And sometimes it doesn't take that form. But one of the things that we're trying to do in this, in the project, is look at how there are different kinds of projects that move into communities building on different kinds of scholarship, some of which is very activist in its orientation, but other isn't necessarily. Like, there's plenty of work in the history of medicine that I wouldn't really categorize that way. There's also plenty that I would categorize that way. But the work that I wouldn't necessarily categorize that way still can bring really important insights that historians working now might draw from to help formulate what would be like a productive engagement in their community in response to the pandemic, for example. So I think that, maybe I would say that it's that the project, I think, kind of intellectually includes and expands on that to perhaps see intervention as something that doesn't only draw from political sort of frameworks that may have an explicit and self-conscious activist orientation, but that nonetheless are useful in the same way that so many fields in the humanities, even if they're not oriented toward activist work, nonetheless are engaging with big ethical debates that themselves, of course, have very real implications. Whether any given scholar is going there or not, the work is kind of open to someone else picking it up and moving it in that direction. Does that answer your question?
Yeah, I've been thinking along these boundaries too, but yeah, and I have, yeah, that helps to clarify, at least for me. Thanks so much.
Okay, thanks.
Right, we have a question in the chat from Kamala. She wants you to talk more about your use of translational to describe your project. Is there any danger that it reproduces a hierarchy within the medical establishment that describes translational medicine in particular ways?
Yes, thank you, Kamala. I'm really glad you asked this. So actually, the introduction to the survey quotes from the NIH's definition of translational medicine, and then sort of gently critiques and expands on it by saying, because of course that definition only includes really, as you're saying, very traditional approaches to medicine that don't encompass all the things that we've been talking about. And so what we say is, that we think that actually a lot of these humanities projects do the same kind of interventional work that crosses from sort of sometimes theoretical work into, sometimes applied. I mean, that's another term that's sometimes used for this, applied work that can then be used to formulate like what a kind of work in a public space in a community would look like in terms of the methods that you would bring to answering those questions. So it's, I definitely take your point, and it was a deliberate choice in that way, because I wanted to kind of cite that framing and sort of question why it's limited to the kinds of interventions that occur in traditional biomedical contexts, like as I was talking about at the beginning of the talk. So for me, it's a very purposeful kind of citation as a way to draw out the connection, or what would be maybe better seen as a kind of contrast between the kinds of domains that these different methods actually engage in, which I see as opening up a form of critique. It's similar to work that sometimes people use the term public humanities to talk about, but I like the translational term in part because it really makes explicit that there's this kind of move from one domain of work into another, which involves it involves some effort. It involves something like translation, and along similar lines, I'll just mention I was part of this project by a scholar at the University of Oxford this summer. That she has this project called Translating Illness, and she's a languages scholar, and in her initial use, she was using translation in that way, like translating, between languages, which of course is never as simple as like switching one word to a different word, right? There's always all this really rich cultural context that shapes what that work even means. And I like that connotation too, because that of course is a very humanities sort of way of thinking about it. And anyway, that scholar at Oxford shifted her project from translating illness to translating COVID, and did a bunch of interviews with scholars doing related work and put them on their website there. So there's also I think there's kind of a lot of different ways of thinking about that term, but since we're doing it in the context of public health, of course, it always will come back to the association you brought in, at least initially. But my hope is that actually then is an opening for conversations with people in medical fields, rather than as a collapsing into those kinds of epistemologies. I hope that addressed your question, though. Thank you for that.
Thank you. Are there other questions that any of our participants would like to ask Dr. Ostherr? You all are so Angie Fan, go ahead.
Hi, Dr. Ostherr. I was wondering about what you mentioned about the UN call for creatives, and then also when you mentioned about climate change and how the pandemic might be related to that. And it got me thinking about this quartet that I was reading about earlier that did a piece in relation to climate change, and they had a live stream and connected like the different themes and videos of like glaciers melting and then playing that over music. And I was wondering if you all had gotten any response from the music community. Like I know like NPR changed their Tiny Desk concerts to concerts at home and things like that. But I was wondering if you all heard any responses from musicians or music educators. Sorry, my cat.
That's okay. We have, and in fact, I mean, the performing arts are definitely well represented in the database in fascinating ways. I hope that we will continue to get contributions, because I think that even in that example, the question of like, what is a musical response to climate change? And what does that mean? Like, what do we do with it as listeners, perhaps? And how might that intersect with how we act in some way? Like where does kind of a musical response fit into the many different domains of experience that shape how we are in the world? And I've definitely seen a lot of projects in COVID that are musical responses. In my own neighborhood, a couple streets over, there are some retired musicians who do these little concerts in their driveway, like once a week at 5 o'clock. And it's just, and anyone who's walking by can just enjoy it, or come and sit sort of like in the street or on the sidewalk or something. Yes, there's definitely a lot of that. And I think that one of the things that's really interesting about music and about other kinds of art and performing art responses is that it raises, in a way, it comes back to this question of translation, but differently, because it's asking, what are all the different registers of human experience, like sensorial registers and emotional affective registers, as well as more sort of like intellectual registers or textual registers. How can we draw from all of those different ways of experiencing and making sense of the world to formulate responses to things that are sort of overwhelming in the kind of burden of human suffering that is embedded within them? Like what? So how, is it? It may be, I think, that one thing that we will take from this database that we're constructing is that there is a real necessity for turning to registers other than, the purely so-called rational to respond to these kinds of crises, because they sort of exceed that as a frame of interpretation. Do you know what I mean? So that's sort of how I see the music response fitting in. And again, I hope to see a lot more. We've seen a lot in a number of different arts, sculpture, theater. Yeah.
That's so awesome. Thanks.
You're welcome.
Well, we're rounding out to the end of our hour, so I don't want to keep Dr. Ostherr longer than that. So I'd like to thank everyone for joining us this afternoon, and hope that you all are able to stay dry in this crazy weather, and maybe not freezing in this crazy weather. So again, I posted the links to the other upcoming events. Please feel free to join us for any of them. And thank you, Dr. Ostherr, for a great conversation. I really appreciate it. So thank you, everyone.
Thank you. Thanks for inviting me, and thanks everyone for coming.